So this slide shows some of the information that's relevant on the currently available SARS-CoV-2 vaccines that have EUA designation in the US. The first row is relevant to the Pfizer vaccine. The second has information about the Moderna vaccine. Both of these are the mRNA vaccines. And then the third row contains information about the adenovirus vector vaccine. You can see in the third column the differences in dosing. So the big advantage of the Janssen or Johnson & Johnson vaccine is that it's a single dose compared to the mRNA vaccines, which are 2 doses. Only the Pfizer vaccine is approved for use in older age adolescents, year 16 and above. The other 2 are for ages 18 and above. And what's really exciting and important is how effective all of these vaccines are. So the efficacy in the US is indicated in this column. The mRNA vaccines that many of you have heard about are almost 95% efficacious. The adenovirus vector vaccine in the US is 72% effective. And then all 3 are very effective against severe disease, which we classify as someone having pneumonia and their oxygen being low, perhaps needing hospitalization, ICU stay, and worse. And what's most important is that there have been, in this last column, no deaths related to COVID among any of the vaccines in these clinical trials. So in summary, all of these 3 vaccines are very effective, particularly at preventing severe disease and hospitalization and death. There has been a lot of publicity about the efficacy of the Janssen vaccine. And what's important to know is that it was not directly studied head-to-head with the mRNA vaccines in the same populations at the same time in the pandemic. And they were enrolling patients at a time when there were more viral variants prevalent, which Dr. Upritcher will talk about. But all of these are very effective, and the message is that you should be vaccinated with whatever vaccine's available to you as soon as you can receive it, and not to wait. And currently, the supply that the vaccination distribution site receives determines what vaccine you receive. Unfortunately, we don't have the luxury of choosing which vaccine we'll be receiving.